Hi everyone, and welcome to Psyched with Setmire. What we'll look at really briefly today are what are some of the different types of clinicians or therapists or people kind of working within the field of mental health, and what are some of the things that you might consider when choosing a therapist. So thanks for joining me, and let's talk a little bit about what are some of the different kind of professionals working within the field of abnormal psych or mental illness. And there are quite a few different types of clinicians, but I'm just going to kind of boil it down to the few major ones for you. The first we would call counselors. And a counselor is typically somebody who has a master's degree, which might take you a couple of years beyond a BA or a BS. And the general focus of someone with a master's degree or who has a counseling background is that they tend to help people with problems of everyday life. So they might deal with things like relationship issues and communication, stress, anxiety, things that are kind of typical stuff that we might all face on a day-to-day basis. Now, because a counselor tends to have a little bit less education than maybe the next person, they do tend to make a little bit less money on average, but they see people for about a 50-minute session and do a wide variety of techniques, again, to help people with kind of everyday type of problems. Very, very similar in what they end up doing in the actual work that they do are clinical psychologists. But a clinical psychologist typically has a doctorate or a PhD, and they have a little bit more expertise in things like assessment and working with people with psychological disorders. So again, they will probably still have a 50-minute session, do some kind of therapeutic technique, but they have more training, so they tend to deal with a little bit more severe populations and might also do things like give psychological assessments as well. A psychiatrist differs from the other two that we've mentioned so far in that they have an MD or a medical degree. So they specialize really in prescribing medications for the treatment of disorders. So if you were to go see a psychiatrist, rather than doing therapeutic techniques of some sort, your session is going to be quite a bit shorter, typically 20 to 30 minutes, and it's going to focus mainly on your medications. What are the symptoms that you're experiencing? How are you adjusting to the medication? And so on. So very, very common that someone might see a psychiatrist while also seeing either a counselor or a clinical psychologist. And now psychiatrists tend to make much more on average than the two previous categories, again because they have more schooling and have a medical degree. Another category that you might see somebody go to pretty frequently would be a social worker. And a social worker typically has a master's degree, just like a counselor, and they tend to work within the institutions of society. Very, very common that they're coordinating services, maybe between parents and a school, maybe the legal system, different kind of institutions of society. They might do a little bit of therapy-like techniques. It might be a little bit more hands-on or kind of out in the field. But again, tending to work with the institutions of society, having a master's degree. And then finally, a lot of people who are struggling with mental illness do go to see their primary medical doctor, right? So this might be your family doctor or kind of just your general practitioner. And this person obviously has a medical degree, and they're going to specialize in physical treatments, kind of coming at it from the medical or biological model, but they can prescribe you medication and maybe even connect you with other services. So these are kind of the typical people that someone might see, though there are obviously other options as well, depending on your preferences and your beliefs. A couple other things, when you're choosing a clinician, so maybe you've narrowed it down to the type of person that you want to see, but how do you choose the specific person? A few things that you might do, really, really key, you want to have a good rapport with your psychologist or your clinician. You want somebody that you're comfortable with. You're going to be opening up and sharing things with this person, so it's really important that you feel at ease with them and that you feel that you can do that. One thing that you might consider when trying to find someone is ask your friends and family or colleagues. Ask people in your life, do you have a therapist that you go see? What do you think about them? Do you like them? Ask around, see if anybody that you know has somebody that they might recommend. That's one way that you can kind of find a good person pretty easily, by connecting with those you already know. You might also shop online if no one that you know is seeing someone or you don't feel comfortable asking your friends and family, you can go online and do things like Therapist Finder through the American Psychological Association website and others. Oftentimes these might contain a picture, a short summary, or credentials, so you can look online for people in your area. A picture tells a story. Again, you want to be comfortable with whoever you're choosing, so look at their image. You know, if they have a picture on their website or one of these Finder kind of places, and do you feel comfortable? Do you get any kind of intuitive feeling that you would want to work with this person, or does something kind of put you off about their image? A picture can tell you a lot, so look at their images, see if they look like someone you might be comfortable working with. You might consider gender. For some people, they might want to work with someone of the same gender or a different gender from themselves. So if you want to work with a woman or maybe a man or other, right, it's really important that you maybe know that ahead of time. Try and pick someone of the gender that you're comfortable. You can ask a therapist their theoretical orientation. Now be careful to say theoretical orientation, or if you just say orientation, they might think you're asking about their sexuality, which is totally fine. You could ask that as well, though they may or may not tell you. But someone's theoretical orientation is going to tell you how they approach counseling. Do they believe in unconscious motivations? Are they a behaviorist? Do they look at cognitions and thoughts? Are they kind of eclectic and combine everything? You can ask someone, how do you approach counseling your clients? And maybe get a little bit of an idea about what they do typically. Eventually, you'll probably want to call this person, call up the therapist, either to schedule an appointment or ask some of these questions, and notice how you feel on the phone. Do you feel comfortable? Do you feel awkward? Obviously, a first phone call might be a little on the awkward side, but what do you notice about how you feel? That might also tell you quite a bit. And how you feel is something that might come up again, right, once you go into therapy, a very stereotypical phrase, but how do you feel when you're on the phone? You also probably want to find out their credentials. What did they get their degree in? Where did they get their degree? Are they certified? Are they licensed? Do they have an area of expertise? If you want to see someone for a specific reason, for example, you need support with schizophrenia, you're going to want to make sure you find somebody who has a background and strength and information in schizophrenia. So what are their credentials? And finally, a really, really large factor for a lot of people, what are their fees? What are they going to charge you for a session? And what does that look like? How will they bill you? Do they accept insurance? Do they accept your insurance? So all of these things might really shape who you pick. But again, I think the driving force is that you really do want to feel comfortable and at ease with whichever one of these individuals that you do select. So knowing the different type of therapist, knowing some of the things to look for, will help set you up for success. And feel free to shop around. If you go to someone and you don't feel comfortable, try someone else out. Better to do that in the beginning than to stick with somebody that you aren't necessarily happy with for whatever reason. So thanks for joining me today on Psyched with Setmire. I hope this was helpful, and I will look forward to you joining me again in the future.